Hey, so this is the cardiac and abdominal part of my exam. I've already washed my hands. Blood pressure and vitals were already assessed. There was no pulse deficits when I've assessed your apical and radial pulses. So I'm going to start by auscultating the four landmarks on your chest. First being is the aortic on the right side, second intercostal space, pulmonic on the left side, second intercostal space, tricuspid on the left side, fourth intercostal space, mitral on the fifth side, left intercostal. I'm listening for S1, S2, and any murmurs. I'm going to start by using my diaphragm, then we'll repeat it using the bell. So starting on the right side, your aortic. Left is a pulmonic. Tricuspid. Mitral. Repeating it again using the bell. S2 is heard. Tricuspid. And then the mitral. S1 and S2 are both heard. No murmurs were heard. I'm going to ask you to lean forward 30 degrees and I'm going to listen and feel for your apical pulse. Okay. So. Okay. Do feel it. No bruise felt. I'm going to listen using my bell. Okay. No bruise heard with the stethoscope. I'm going to ask you to lay 30 degrees. I'm going to repeat the cardiac exam that I just did with you laying 30 degrees. So I'm going to listen to the four landmarks that we just assessed, starting with the diaphragm. Right side is the aortic. Left second intercostal space is the pulmonic. Left fourth intercostal space is the tricuspid. Fifth is also the tricuspid on the mitral. Okay, and while you're laying down, I'm going to listen and assess for the apical. Fifth intercostal space. So I'm going to feel for it. Okay, and then I'm going to listen using my bell. Okay, no bruise heard. I'm going to assess your carotid. So the difference between JVP and carotid is that with carotid you see the pulsation. I do see it if you turn a bit. I'm going to put my 2 fingers to feel for it. 2+ pulses. I'm going to listen for any bruise in your carotid using the bell. Okay, and no bruise are heard, and usually you would do it on both sides. I'm going to assess for JVP. So I have a ruler here. I'm going to put it over here and take this tongue depressor, line it with the highest pulsation that I see, and it is at about 2 centimeters. Moving on, I'm going to assess your abdomen. So for this part of the exam, I have to inspect the skin, auscultate, percuss, and palpate your abdomen. Is it okay if I lift up your shirt? Mm-hmm. So I'm looking, there's no scars, skin is intact, there's no hair, abdomen is flat. So I'm going to assess by first auscultating on the right upper quadrant using my diaphragm. And you go to all 4 quadrants for 3 to 5 minutes to hear normal active bowel sounds. Okay, normal active vital sounds were heard in all 4 quadrants. I'm going to switch over to my bell and listen to your arteries for any bruise, starting with the aorta, iliac, renal, and then your femoral. Okay, no bruise were heard. I'm going to feel for your inguinal nodes. Nothing was felt. Okay. I'm going to percuss your abdomen starting in the right upper quadrant. So I'm going to take my 2 fingers on my left hand, lay them flat, and use the other 2 to tap in between. And I'm supposed to hear tympanic sound. And that was heard. I'm going to palpate. 2 types of palpation, light palpation and then deep palpation. So I'm going to start with the light on the right upper quadrant. Okay. Abdomen is soft. I'm going to do deep palpation, looking for anything abnormal such as organs and masses. No mass is felt. The next thing I'm going to assess for is your liver and spleen. So your liver on the right side, I'm going to start by percussing. I'll do it here. Okay, so you go above the rib cage and you're going to work your way down until you hear a dull sound. And normal is 6 to 12 centimeters. Right about here you hear the liver. I'm going to do the same thing on your left side for your spleen, and spleen is usually not heard. It remains tympanic. I'm going to use the hook way to assess and feel for your liver. So you go to the right side, you're going to find the end of your rib cage and kind of like deeply just relax, hook your fingers underneath. I do feel the liver. I'm going to try it again on your left side for your spleen. And it's not felt. Usually if the spleen is felt, you would worry or have concerns for splenomegaly. Okay, so for this part of the test, the abdomen, I'm going to ask you to sit up and I'm going to do the CVA test to assess your kidneys. So the way that this part of the exam works is I'm going to put my hands on your right flank and I'm going to kind of punch it, and this is testing for kidney stones or hydronephritis. So since you did not jump, there's no reaction to it, the test is negative, and this sums up the test for cardiac and abdomen. Good, right?
Yeah.